All right, next exercise I'm going to do here is a straight leg passive raise. All right, this one's going to get some stretching in, some flexibility in of the hamstrings of this exercise here. And just also helps out the lower back as well, the lumbo-pelvic area, and just making sure that stays in a neutral position. All right, as we do this. So I'm going to get started, set up, all right, in a supine position. We won't get full view of the legs going down and everything just because of the way the camera is set up and how everything is nowadays. So you can set up in that supine position. All right, here. Start off with both legs. All right. Straight down. Sorry. Both legs straight down. All right. And as I'm here in that supine position, just because I'm looking at the camera, but what you're going to make sure is you're going to have that neck flexion here. So you're going to make sure you keep that neck in a stable, all right, neutral position, just so you keep that spine in a neutral position all the way down, all right, to that lumbar there. Now what we're going to do is going to start off getting some hip extension and hip flexion, and also maintain knee extension as I'm doing this exercise. So I'm keeping one leg down, all right, this presentation here, keep my right leg down, all right, and start off getting that hip flexion throughout my left leg. And as I'm doing this, you want to do this with like a person here, so they can be able to push, all right, to a certain point of where you'll feel tension, feel pain. Okay, so as I'm coming up, trying to keep that knee flexion as much as possible. It's very hard to do it by myself. I want to keep that knee flexion there. All right, I'm pulling in. I'm going to just use my hands here to give me more of a boost, all right, in that pull. So I'm pulling in, all right, holding it just for a few seconds. All right, get a nice little stretch here in those hamstrings here as I'm pulling in. All right, watching out, looking at that mobility of the hips here. All right, as I'm coming up and that flexion, keeping that knee, all right, in that extensed position. And also, as I'm doing this, you can't see in the video here, but with my toes, I'm getting that dorsiflexion. So I'm pulling my toes towards me. All right, just tell your patient or whatnot, pull those toes towards you. It also gives me a little bit more, all right, of that hamstring stretch there. All right, as I'm going through those range of motion. So go back down, all right, let it off for a few seconds, all right, and come back up. Same thing, all right. I'm not gonna use my hands this time. Let it be passively, all right, not active. All right, as I'm going up, coming back down, and also as I'm going up as well, I'm gonna make sure to keep that posterior pelvic toe, keep that lumbar, keep that back nice and flat on the floor, all right, as we're doing this. Go up, hold it for a few seconds. All right, this time I'm doing the opposite of that dorsiflexion, going plantar as much as I can, just to feel a little difference between the two. Put it back down in a relaxed position. You know, same thing from the other side, doing that as well. Okay, so this helps, you know, if you, these exercises help for patients who might deal with like this hernia, or even like just any tension or so throughout these ranges of motion. So throughout these degrees, you want to see how high that patient can get that hip and that flexion. So 90 degrees, all right, perfect. You know, there as high up as I can. I just did some squats, so don't judge me. As 90 degrees as much as we can, all right. Or if it limits here at 45 degrees, you can tell you have some neural problems, maybe some neural problems, all right, throughout that lumbar spine. Or if they get it between 35 and 70 degrees there, you can tell that's just a little bit more of those muscles just being tight there, all right, the quads or maybe the hamstrings. Or if they get it up to that 90, almost to that 90 degrees, but they still feel a little tension just because they have some joint, all right, pain or so, which myself right now has, which I can't get this right leg all the way up to 90 degrees there. Just knocked out a few squats from a workout. But that's that passive straight leg raise.